All right, hello, class of Public Health 2. My name is Jonathan Liu, and this is my presentation on a case study following folic acid deficiency and neurotube defects. This can be found in Chapter 8 in Milestones of Public Health. Step 1, gathering background information. Folic acid deficiency causes neural tube defects, such as spina bifida and anencephaly being the two most serious. Spina bifida is shown on the bottom right, which is a baby with an underdeveloped spinal cord with an outward protrusion, usually covered by an abnormal tuft of skin or hair, and these babies grow up to have paralysis and mental impairment. The baby on the bottom left is shown to have anencephaly, where they are born with an incomplete brain and skull. This condition is always fatal, and most babies pass away during stillbirth. Step 2, we need to analyze the current situation. According to a study done by the CDC in 2017, 3,000 pregnancies are affected by neurotube defects every year in the United States. Now, to apply this with a SWOT analysis, 81 countries around the world so far have already implemented folic acid fortification, which is the preferred solution. However, a weakness of this is that the majority of countries in Asia and Europe refuse mandatory fortification, citing that a good enough diet is enough to prevent folic acid deficiency. An opportunity that we have to fix this is to participate with public health organizations such as the Food Fortification Initiative, FFI, and their mission statement is to work with countries to improve their national fortification programs, specifically for grain. And a threat to this is while misinformation, poor planning, and public skepticism often undermine the severity of folic acid deficiency and ultimately lead to the problem despite all these resources to fix it. Step 3, prioritizing core issues. Despite vigorous campaigning efforts throughout the years, many women still have insufficient folic acid uptake. Countries where fortification is not required usually have an increase in neural tube defects. Bottom line, neural tube defects are preventable but difficult and costly to treat, considering that the average cost of spina bifida treatment is $22,000 in the first year of life. As of right now, there is no cure for spina bifida or anencephaly. Step 4, analyzing alternatives. The obvious solution to folic acid deficiency is as follows. Mandate folic acid fortification globally and increase access to folic acid supplements. This came from Milestones in Public Health. Now, if we apply the health belief model to this solution and the problem at hand, and putting ourselves in the position of a pregnant or planning woman, we can understand that perceived susceptibility is that neural tube defects do not discriminate. This can happen to anyone if preventative measures are not taken. Perceived severity, neural tube disorders can cause lifelong disability in children, limit life expectancy drastically, especially in the case of anencephaly, cause emotional trauma to the parents, and incur large healthcare expenses. Perceived benefits, neural tube disorders are preventable. The price of prevention is insignificant compared to the price of treatment. And in order to promote self-efficacy, women would be more likely to educate themselves on folic acid deficiency, more likely to maintain high folic acid levels, and consult their gynecologist. And alternatives continued. Solutions that have been considered in the past or have already been enacted involve passing legislature, such as the FDA, mandating grain fortification in the United States, implemented in 1991. This ultimately reduced the occurrences of neural tube defects by 35%. A study performed by Kukuk et al. In Turkey showed that increasing awareness of neurotube defects to general medical practitioners helped, as this implemented a standardized neural tube defect awareness questionnaire, and this ultimately educated patients on the dangers of neural tube disorders, mostly targeting planning families. This showed statistically significant relationships between educational status and the prevention of neural tube defects. Step 5, providing recommendations. The CDC recommends at least 400 micrograms of folic acid each day by taking vitamin supplements or having a fortified diet. In addition, do not take medication that interferes with the body's use of folic acid, and learn about family medical history, as pre-existing cases of neural tube defects can increase risk factor. Step 6, moving forward, we need to establish an action plan. Please note that all of these timestamps are starting from 2022. First of all, mandatory grain fortification needs to be a global priority. World leaders need to act and be informed, preferably by 2029, 7 years from now. Involve government officials who work in the Department of Health to push for a plan for folic acid distribution, similar to the pattern of free feminine products, something that we can find on college campuses, city halls, community centers, you name it. And lastly, I would like to ensure that folic acid remains covered by most health insurances and or drastically reduce the over-counter price, both of these to be done by 2027. Step 7, to finalize and add my opinion. Folic acid deficiency is less of a problem here domestically. However, much needs to be done on a global scale. And ultimately, neural tube defects are preventable. These incidents shouldn't even be considered infrequent. And I understand that it's ideal and naive of me to consider them to be completely eradicated. However, the solutions have been right in front of us this whole time. They have been proven to be cost effective and that they work. So I think much can be done about this. Thank you. And here are the references that I used for this presentation.